make your life easier. Moms Every Day.
Good afternoon, everyone. Glad you're here joining us for Moms Every Day. We're here with Jared Brownfield, who is an OBGYN, and we're talking today about an issue that a lot of women deal with. It's endometriosis. So kind of explain to what it is.
Well, Taylor, thanks so much for having us.
Sure.
I'm glad I can be here because March is actually National Endometriosis Awareness Month.
Really?
And like you said, it's an issue that a lot of people deal with. And so, getting back to your question, what endometriosis is, well, within the female reproductive tract, you have the uterus, or what many folks call the womb, and inside the uterus is the lining, and that's called the endometrium. So endometriosis is a situation or a condition in which the lining of the uterus is found outside of it, and it can be found many places. Often it can be found either on the ovaries or the fallopian tube, or believe it or not, even on the bladder.
Okay, and what problems can endometriosis cause for a woman?
So when you have this situation of the endometrium outside of the uterus, it reacts or responds to hormones, primarily estrogen.
Okay.
And so when it does that, it can cause bleeding, irritation, inflammation, and when that happens, that really manifests or causes pain. And so what happens is a woman, maybe more than what you would expect, can have problems and pain leading up to and during their period, more, like I said, out of the ordinary, and in long term in this situation, that inflammation can lead to scar tissue or adhesions, and you can really get long-standing or long-term pelvic pain. And so that's really a lot of the problems folks have with endometriosis primarily.
Sure. And for women who may be dealing with this, may be wondering too, can this cause infertility?
It can, unfortunately, as I just mentioned with the scar tissue or the adhesions that form, many women with infertility issues or problems are found to have endometriosis. As many as 40% of folks with infertility.
Wow. And
that, like I said, is kind of linked to that scar tissue, those adhesions, among other things.
How common of a problem among women? How often do you see this?
Yeah, so in my job, we see it every single day, but in women of reproductive age, it's found in as many as 1 in 10 women have endometriosis.
That's an amazing statistic there. So, how do you go about diagnosing it with women?
So you can diagnose it in a couple or few ways. First and foremost, we encourage, or we want folks to, if they think they may have it, or if they're having any problems or symptoms or issues, to go and talk to your healthcare provider with an OBGYN or a women's health service provider. And often we get suspicious based on clinical findings, on symptoms, maybe on a physical exam, and you can start with trying some medicine to see if that helps. But the most definitive way to diagnose endometriosis is through a surgical procedure called a laparoscopy, in which we look inside the abdomen, down towards the pelvis with a camera, and if we see endometriosis, we can take a tissue biopsy of it and then go off of that diagnosis to really definitively tell whether or not someone has endometriosis.
And then how do you go about treating it?
So once you have a diagnosis, or you're suspicious for a diagnosis, the good news is there are many treatment options. There are many ways to treat it. First and foremost, we usually try more conservative treatments, which comes in the form of medications. One of the leading medicines that we use are birth control pills, and maybe a lot of folks are familiar with birth control pills and they've used them in the past, but we use that for more than just birth control. It can be used to treat many diseases, endometriosis being one of them.
Okay.
But in addition to that, I talked about the inflammation, the irritation that can occur. Often NSAIDs or anti-inflammatory medicines can help, and we have plenty of other medicines that we have up our sleeve, so to speak, to treat endometriosis. But so you've got the medical kind of side, but then sometimes, depending on symptoms, how long they've been there, the severity of things, and where a woman finds herself, and what her future plans are with fertility, surgery also can be an option. And there are multiple surgeries that can be performed based on what really is going on.
And what do you suggest for women out there who may think that they're going through some of these symptoms?
First and foremost, if some of the symptoms we've mentioned or brought up, if you're having those, or if you have a concern for possibility of having endometriosis, the first thing is to have a conversation with your healthcare provider, or maybe find an OBGYN to talk to, and that's really where I would start.
All right. Well, doctor, we appreciate you being here today. Thank you so much. If you need more information, head to WSAZ Mobile, click on Moms Every Day. We'll be right back after the break.